All right. Been a minute since I've made a video. Um, if you missed my last short video, we're in the process of moving out of our fourth floor apartment into a townhome to save some money, but also it's going to be a lot bigger and give me space to be able to do some recordings. I'm also working on um, a treatment room where I can do some recordings as well, which will allow me to create some variety in these videos. If you're new here, welcome back. My name is Marshall. I'm a licensed massage therapist, corrective exercise specialist, TRX instructor, nutritionist. And in the middle of all the moving, I just wanted to do a quick check-in. I'm also on my own weight loss journey. I gained 100 pounds while being bedridden for the most part, with an autoimmune disease that got worse over the last 8 years while I was living in Boise. And I moved back to Olympia, and my symptoms started getting better. So environmental factors. So I'm now in the process of losing all the weight that I gained. I'm going to be covering how I'm doing that and my progress on this channel, as well as training videos, therapy videos, and more. So stay tuned. Videos will get better as I progress forward. I'm also looking to eventually get a camera. Right now I'm just using my cell phone, my iPhone. It's an older one. But anyways, so just a few things. My weight is still going down a couple pounds a week. I'm into the 260s now, down from 281. And definitely clothes fitting better. Cardio has come way up. A lot of muscle memory and cardiovascular system there. So that's been great. Jess and Lucian have been competing in races. They're taking a 2-month break to move and do some training. They'll be back at it in October, November. In the meantime, what I did want to talk about briefly tonight is massage in general as a concept. So massage is so widely viewed as this thing that is something you earn. It's this fluffy, relaxing experience that you do when you're on vacation. And that's not what all massage is. There is that type of massage. We call that spa massage. But what I do is medical treatment massage. And so when you come to see me, a lot of you have insurance that'll cover it. And I can literally fix things like carpal tunnel syndrome in 1 to 3 treatments, plantar fasciitis, chronic low back pain, chronic headaches, shoulder impingements, things like that. It is a medical treatment. And some of these things are very easy to fix, done in 3 treatments to 3 months of treatment, depending on how severe it is. And in the meantime, there's people out there getting surgeries, like carpal tunnel surgery. That is the percentage of people that have success from carpal tunnel surgery is not very high. I don't know what the official numbers are, but I get a lot of people coming in. They tell me, oh yeah, I got this side done and it's so much worse. I don't want to get the other side done. Or, oh, my friend got it done and scary stuff. I don't want to do it. There's some people that get it done and they get a good result, but it's not everybody. It's kind of a crapshoot, to be honest. And yet, with what I do, everybody, and I mean everybody, 100%, in just a handful of treatments, the symptoms go away. There's no reason for surgery. So, I think as a whole, ideally I would love it if there was some differentiation between the type of massage I do and spa massage. It would really help. for people to understand that they're not the same. There's two different things out there. And medical treatment massage does not mean spa massage with deep pressure. That's not what this is. And the people that are claiming to do medical treatment massage that are just doing spa massage techniques with deep pressure don't know what they're doing. Unfortunately, there's a lot of people out there that don't actually know what medical treatment massage is. They don't know about concepts like altered orthokinematics and, the I won't go into a long thing here, but basically, they don't have that training. They're coming out of massage school. They hear medical massage. It sounds like a term that's going to get them hired. They claim they can do it. If that's you're a massage therapist and you haven't had proper training, you're claiming medical massage is you think that it means focusing on one area. That's not what it is. Okay, the client says it hurts right here. It doesn't mean spending the whole hour rubbing that spot. It means understanding why it hurts right there, understanding the light-tension relationships, the altered orthokinematics, the fascial adhesion patterns, like anatomy trains teaches, stuff like that. And if you don't have the right training, please don't claim to be medical treatment massage. Stay within your wheelhouse, because it makes it harder for the rest of us when people go, oh, I went to a medical massage person and they didn't help me, or it didn't work, or whatever. That person didn't get the help they need. Now they're turned off to this whole idea. And that's why we need some form of differentiation in the industry. But anyways, for those of you that have something that is within the medical massage wheelhouse to fix, like carpal tunnel syndrome, plantar fasciitis, shoulder impingement, chronic headaches that are not from a spinal injury that requires surgery, right? If you have a bulging disc, we can at least help. If you have a ruptured disc, can't help you. Then you need surgery. If you don't have a bulging disc or a ruptured disc and you just have chronic headaches, you likely have forward head syndrome, because almost everybody does now, from looking down at phones and staring at screens all the time. I can fix that. Shoulder impingement, we could fix that. If you have a labrum tear, can't fix that. That's surgery. But if you have an impingement with no tear, we can fix that. So, and I do integrated therapy, not currently for the clinic that I work at, but I'll be discussing integrated therapy on this channel. Integrated therapy means I can actually fully fix that. I can give you the exercises, I can give you the release techniques, I can give you the stretches, all of it. The difference between that and PT, because a lot of people ask that, what's the difference between PT and what you do? One is you're going to get more time. You're going to get a complete, this is exactly what needs to happen in real time. And it's not going to be 15 or 30 minutes or 45 minutes. It's going to require you to put in some real time at home. And these videos aren't going to be short. We're going to walk you through the exercises, the release work, all of it. And you'll learn exactly how to do it step by step. So one, more time, the right amount of time. It's not going to be, in and out in 30 minutes. Two, what I do is taking you from where you are, not just to, okay, you're good enough to go back to work, so good luck, and here's some stuff to keep doing at home. You can follow my channel and what I do from where you are to where you want to be. Not just out of pain and more functional, but from that point, we can build it up, increase joint stability, increase proprioception, increase muscle strength and function, essentially bulletproof it so that it doesn't happen again. And for that matter, taking people from being at the therapy level to the athletic level. You don't have to go from therapy level to being able to get by day to day. I have literally taken people off the couch to marathon, to Ironman, to sponsored athlete level. I've done it numerous times. But what I would like, if you're watching this video, I've worked with you in the past, and I have taken away your pain or fixed your problem, whether it's shoulder impingement, whether it's carpal tunnel, whether it's low back pain, chronic headache, whatever it is that I fixed for you. If you're watching this video, help me to encourage other people by letting them know that you got the help you needed. So leave a comment below, whether you found this video on YouTube or Facebook. If you're seeing this on YouTube, go friend me on Facebook. If you're seeing this on Facebook, please like, subscribe, hit the notification bell on my YouTube. All you gotta do is just click on this video and follow the link over. In the meantime, stay tuned. I promise, once I get this move over with, I will start producing full-length videos with all the information that everybody needs to start fixing their problems, to start improving their fitness level or general health, to lose weight, all the things. I've been doing this for 30 years, and I want to be able to help more people, and I want to be able to have a passive income. I don't want to, go to work and treat 36 or 40 patients a week, busting my butt and only helping 36 or 40 people in a 3-month or 6-month period, and then also just barely be able to pay my bills. I want to help thousands of people. And, I've had a school. I've trained half a dozen other people, up to almost the level that I'm at. They don't have as much experience as I do, but they got an education directly from me, and they're out there helping people. But still, if it's only 36 people a piece, and I guarantee the rest of them are not doing 36-hour weeks. So let's say 25, 30-hour weeks. Like it's 30 people times 6 is only 180 people getting help they need. So let's see if we can do this through Facebook, because long before I was actually physically doing the manual therapy work, I was teaching people how to do it on themselves using tools and teaching the exercises. And I think that with the YouTube, the technology of today, going back to doing it the way I was doing it, 25 years ago, teaching groups of people, only this time through YouTube, I can teach thousands of people. And so that's the goal. So like, subscribe, share. Let me get the channel going. If you're a little bit reluctant right now because my initial videos haven't been that great, I get it. Like and subscribe to yourself. Hit the notification bell. When the better videos start coming out and you see for yourself, then share. In the meantime, keep tuning in. I'll see you on the next video. Namaste.